all felt the way that stress knots our stomach or how hunger makes us irritable. These moments reveal that our physical and our mental health are connected. How many of you have left the doctor's office feeling dismissed or maybe misunderstood by a provider? How could recognizing the mind-body connection transform your healthcare journey? While we're on the path to embracing integrated physical and mental health care, it remains underutilized and many still overlook the importance of addressing both together. Hi, my name is Hannah and I'm a doctoral student in clinical psychology, and I've had the privilege of working with individuals who have had physical and emotional challenges. People whose anxiety is felt physically in the form of stomach aches, for example. And what I've learned is that the mind and body are not only connected, but are in constant conversation with one another. Today, I want to share with you why it's time for you to embrace a whole person approach. So a couple of years ago, I was sitting in the doctor's office waiting for another appointment for my husband's stomach aches. And at the time, it felt like nobody really had answers, and those appointments were about managing the symptoms, medications, scans and procedures to look for something that they really weren't finding. And what struck me even then was how little anyone asked about the rest of his life. It wasn't until years later during my psychology training that I started piecing together that the stomach aches weren't unrelated to his stress. His mind and body had been talking to each other, but we only listened to half the conversation. Similarly, the first time that I went to a therapist, I expected her to ask about my thoughts, my feelings, and she did, but I also unexpectedly left that appointment with an order for blood work because she had noticed signs of anemia. In my case, anemia wasn't just a medical diagnosis, it was an emotional one too. At first, I was solely focused on the emotional side of my exhaustion, neglecting that something physical could have been contributing. It was this heaviness, like a weight pressing down on me, that made everything feel so much harder to do. And I felt really disconnected from my own life. I withdrew, not because I didn't care, but because caring took a lot of effort and I had none left to give. So when my therapist suggested getting blood work done, I almost brushed it off. I remember thinking to myself, how could something physical like anemia explain something as deeply as emotional as this? But when the results came back and we started managing the anemia, it kind of started to make sense. And that experience changed how I see mental health. It showed me that sometimes what is seemingly emotional can have a physical root, and that the outdated division between physical and mental health misses the point that they're not separate. And that's why we need to be aware of integrated dimensional perspectives. But this vision means reducing the stigma that keeps us from talking about mental health, advocating for services that consider our whole picture, and it means training clinicians to embrace that model that starts by asking what's your story instead of what's wrong with you. In my experience, optimal well-being requires a holistic approach because fragmented care can mean untreated symptoms, duplicated efforts, and dissatisfaction with your healthcare experience. But whenever we address that connection, research shows that it not only improves recovery rates, but also improves our immune functioning, enhances our physical and mental well-being overall, leading to measurable improvements in our overall quality of life. I've seen this both in my own story and in my work as a clinician. Looking back, what if we would have conceptualized my husband's stomach aches a little differently? What if the root of his digestive complaints weren't just a straightforward medical complaint, but instead an interplay between biopsychosocial factors? Did you know that the brain and gut communicate through a bidirectional complex network involving the central nervous system and your gut's microbiome? In fact, about 90% of the body's serotonin, the happy chemical, is found in the gut, where it not only contributes to mood, but also to gut sensitivity. So that's like your digestive system's reactiveness to things like stress and food. That biopsychosocial spiritual model of health emphasizes the interplay between biological, psychological, social, and spiritual factors. But our healthcare experience often compartmentalizes and separates these components. So you may be unaware that conditions like anxiety and depression can contribute to physical symptoms such as digestive issues, or that physical conditions can take a toll on your mental health. But understanding this connection can change the way you think about your health. And the way you think about your health shapes how you experience it. When people understand the connection between that the mind and body are connected, we're more likely to advocate for care that addresses our full picture of health. So what does that full picture of health look like? Let's talk about integrative care, a model where professionals from multiple disciplines collaborate to treat the whole person. Going back to my husband's situation, that might have looked like a gastroenterologist, a psychotherapist, and a nutritionist working together, recognizing the connection between his gut and brain. They collaborate and create a personalized care plan that addresses his physical symptoms and his emotional well-being. And that's going to foster long-term resilience instead of just symptom relief. This is what healthcare can look like, but barriers exist. There's limited provider training, insufficient funding, and our societal under-recognition of the mind-body connection that hinder its accessibility. It's easy to feel stuck with those obstacles cycling through appointments like we did, and while I can't change how we navigated care back then, I can empower you to advocate for more comprehensive services moving forward. First, by communicating your full experience, not just your physical symptoms, but also any stress you're experiencing, because those symptoms don't exist in isolation. And providers, take the time to ask about stress. Care that goes beyond a single specialty when appropriate. Addressing those physical symptoms is important, but combining that with support for your mental health, stress management, nutrition, can lead to effective long-term solutions. And providers themselves ought to be building relationships with other disciplines so that patients can receive well-rounded care. Lastly, advocate for an integrative experience by asking how your experience could be connected to stress, or is there someone who could help you with the emotional toll of a physical condition? Even small questions like these can push providers to think more holistically and collaboratively. While this level of care isn't yet standard or accessible in many places, change can start with us. We can start by advocating, asking questions, sharing stories, and challenging our providers to think holistically. Breaking down the invisible border between physical and mental health requires a collective shift in how we think about our wellness. Your mind and body are part of a single interconnected system, and the signals they send, the stories they tell, aren't meant to be dismissed or divided. Embracing a holistic lens, we recognize the wisdom in this dialogue and can instead meet symptoms with compassion and collaboration, not compartmentalization. This is the vision of integrative care, and together we can advocate for a healthcare experience that reflects this vision, because the border between physical and mental health isn't a wall, it's a bridge, an invitation to connect, heal, and grow together. Thank you.